if you're over the age of 65, these are 4 quick tests you can do at home to test your functional capacity and also your falls risk. Functional capacity refers to things that you might do every day, like climbing stairs, getting up and down out of a chair or a couch, and making sure you can keep doing those for as long as you need to. The first test we're going to do is a 30-second sit to stand test. And it is just as it describes. We're going to take 30 seconds and see how many times you can sit to a chair and then stand all the way back up without using your hands. So the test will begin with your hands across your chest, sitting all the way down, taking your weight onto the chair and extending all the way back up. Your feet have to stay planted on the floor. You can't stomp them into the ground for momentum. Now, for men, we're looking for a score of 14 or above. For women, it's 12 or above. Anything less than that in 30 seconds, and we would say you are at risk of losing some of your functional capacity. And that can be an indicator that you need to go and see someone to start an exercise program to build that back up or prevent any further loss. The second test we're going to do is called a functional reach. And what that measures is our ability to extend our body away from our center of mass before we lose balance, and how we feel in terms of our safety and ability to do that. So the way to run the test is we stand next to a wall without leaning on it, extend the arm nearest to the wall as far as you can, and we measure from the front of the knuckles when you've made a fist. Then we mark that point and get the person to lean as far forward as they can, trying to reach until they feel like they can't go any further without losing their balance, and we measure the distance between those 2 points. So a score of 25 centimeters or more is considered normal or good. Between 15 to 25 centimeters for an older person, your falls risk is going to be double. If your score is between 10 to 15 centimeters, then we say that your falls risk is going to be increased by a factor of up to 4. And again, this could indicate that there are some deficits and you need to consult a professional, come up with a program that might help you improve those to reduce those risks again. The third test we're going to look at is a timed up and go. And this is a very easy and simple measure of dynamic balance. So our ability to keep our feet and change direction while we're moving or while we're thinking about other things. So all we need to do is set up a chair and a marking point about 3 meters away from the chair. We start sitting, and then on go, the aim is to stand and walk as fast as you can to the 3 meter mark and back, and sitting all the way down. The test is complete once we are sitting again. Now, for this test, a good score is anything less than 12. Above 12 seconds, we start to look at what might be impacting that. Things like our ability to turn around, the size of our stride, and other factors impacting our balance can play a factor. So again, this is going to be an indicator of whether or not you have some deficits that can absolutely be improved with some help from a professional and a good exercise program. The last test we're going to look at is called a near tandem stance test. And this is purely a measure of our balance. Now, it is a good idea to have something or someone nearby that you can reach out to and hold on to if you need to, if you are concerned about your balance. Now, to set up for this test, we need to have our heel and toe about 1 inch apart. So they don't need to be perfectly in line, just slightly off center and about 1 inch from the heel to the toe. Once we have this stance and we're comfortable, the aim is to close your eyes and hold your balance for a total of 10 seconds. You don't need to keep holding it once you have achieved 10 seconds. All we want to do is notice whether you feel the need to open your eyes and rebalance yourself. We want to test both sides so that you have an understanding of if you are more balanced on one side than the other. And what this test looks at is our dependence on our vision for our balance, because we know that our balance is also impacted by our muscles, joints, ears, and perhaps even medications. So understanding how much of a role those things are in our balance and how much they're impacted can tell us what type of program we need to apply in order to improve. If you've got any concerns about your mobility, strength, or balance, and you would like to get a program sorted out to help you with these, please shoot us a message or come in and see us here at 99. We would be happy to help.